Welcome to today's video. Did you know that our bodies are constantly sending signals, warnings before a serious problem occurs? However, in our busy lives, sometimes lacking attention, many of us ignore these signs, causing health issues to become more serious. And sometimes, a simple sign can be a warning of an emergency problem that, if not handled promptly, could threaten our lives. In this video, we will explore 7 emergency warning signs in the body that you absolutely should not ignore. These signs are not always clear, but if you know how to recognize and take action in time, they can help you reach the hospital in time and save your life. From chest pain, shortness of breath, to unusual symptoms related to brain or nervous system, each sign is a warning from your body asking you to listen and respond immediately. So, what are these signs and what should you do when encountering them? Let's explore in this video because who knows, it may help you identify dangerous symptoms and protect your health as well as your loved ones. Get ready to receive some important information because sometimes just one timely decision can change your life. Let's get started. 1. Slurred speech or facial distortion. Emergency stroke warning signs. One of the most obvious signs of a stroke is when you or someone around you starts having difficulty speaking or noticing a facial distortion, with one side of the face drooping. These are signs of a serious condition that needs immediate attention. Stroke is one of the leading causes of death and disability, and when it happens, time is a critical factor in survival. When experiencing this sign, the patient may feel that their speech is slurred, unclear, or they may be unable to pronounce words as usual. The face might be drooping on one side, causing one corner of the mouth or an eye to fail to close properly. This happens when brain cells are deprived of oxygen due to a blockage in the blood vessels or a brain hemorrhage, leading to severe body function impairment. Certainly, when you see someone showing these signs, the first reaction is not to panic, but to act quickly. Delaying medical intervention can have serious consequences. Studies show that each minute that passes without stroke treatment leads to the loss of about 2 million brain cells. Therefore, acting immediately not only helps save the patient's life, but also minimizes long-term consequences, aiding in functional recovery. In this case, the patient needs to be taken to the hospital immediately. To easily recognize and quickly handle the situation, doctors and nurses use the FAST method, face, arm, speech, time, to detect strokes. It is crucial that when signs of a stroke appear, you should not wait until the situation worsens or attempt self-treatment, as timely medical intervention is the key to saving lives and reducing brain damage. So, when you notice slurred speech or facial distortion, do not hesitate. Call for an ambulance immediately to get timely medical care. Remember, in the case of a stroke, every second counts. 2. Sudden chest pain or tightness. Warning signs of a heart attack. Sudden chest pain can be a serious warning sign of a heart attack and should not be overlooked. Chest pain can present in various forms, from a feeling of tightness, pressure, or burning in the chest area to pain radiating to the arm, neck, or jaw. Especially in the elderly, heart attacks may not present with the usual obvious symptoms and are often overlooked or mistaken for other issues such as acid reflux or stress. When experiencing chest pain, the first sensation might be intense pressure or an uncomfortable burning feeling in the chest. Sometimes, the pain can radiate to the left shoulder, arm, neck, and even the jaw. These symptoms are easily mistaken for acid reflux or anxiety, but in reality, they could be signs of a heart attack, especially when combined with shortness of breath, dizziness, or unusual fatigue. It is important not to delay seeking medical attention or self-diagnose. While one might think that the pain is not severe, in reality, chest pain can be a sign of a rapidly progressing cardiovascular issue. Especially in the elderly, heart attack symptoms may be milder and easily ignored. However, failing to seek timely treatment can lead to dangerous complications, including permanent heart damage or even death. If you or a loved one experiences sudden chest pain, do not wait. Seek medical attention immediately or call for emergency help for timely support. A heart attack can happen at any time, and quick action is key to saving lives. These signs should not be ignored, as early intervention could help save a life and minimize the risk of serious complications. 3. Sudden shortness of breath without physical effort. Warning signs to pay attention to. Sudden shortness of breath without physical effort is a symptom that should not be ignored, as it could be a sign of a serious medical condition such as heart failure, pneumonia, or pulmonary embolism. If you experience this condition, seek medical attention immediately, especially if the symptoms appear suddenly or become severe without any prior physical activity. Shortness of breath is often a sign of respiratory or cardiovascular issues. When the heart is unable to pump blood effectively, heart failure, when there is an infection in the lungs, pneumonia, or when a blood clot blocks a blood vessel in the lungs, pulmonary embolism, these organs fail to supply enough oxygen to the body, causing shortness of breath. This symptom often appears suddenly and can make you feel like you can't breathe even while at rest or not exerting any physical effort. In the case of heart failure, shortness of breath may be accompanied by fatigue, dry cough, or swelling in the legs. Pneumonia usually causes chest pain, cough, and fever, while pulmonary embolism can lead to sudden shortness of breath and chest pain, sometimes accompanied by coughing up blood. These conditions require immediate medical attention as untreated. They can cause dangerous complications that affect health and life, especially in the elderly. Shortness of breath may not only be a common symptom of aging, but also a sign of rapidly progressing serious diseases. Therefore, if you or a loved one experiences sudden shortness of breath with no clear reason, do not hesitate. Go to the hospital immediately for checkups and timely treatment. Sometimes, early intervention can help save lives and minimize the risk of severe consequences later on. For sudden confusion or disorientation, warning signs to be aware of: sudden confusion, forgetting familiar things, or losing direction can be warning signs of a serious health condition. Especially when these symptoms appear suddenly, they are not just signs of fatigue or stress, but could be related to a stroke, infection, lack of oxygen, or a reaction to medication. In these cases, seeking immediate medical care is crucial. When a person suddenly cannot recognize familiar objects, forgets the names of loved ones, or loses orientation even in familiar surroundings, this may be a sign of a stroke. A stroke occurs when the blood supply to the brain is interrupted, leading to oxygen deprivation and brain tissue damage. One of the common symptoms of a stroke is a sudden change in cognitive ability and memory, causing the person to forget important information or be unable to identify their location. In addition, infections, particularly urinary tract infections, pneumonia, or sepsis, can also cause confusion in the elderly. When the body suffers from a serious infection, the brain may be affected, leading to cognitive changes that cause the person to become disoriented or unable to distinguish reality. This is common in individuals with weakened immune systems or underlying conditions. Another cause of confusion or disorientation is lack of oxygen. When the body does not receive enough oxygen, the brain can also be affected, leading to symptoms like difficulty concentrating, forgetfulness, and disorientation. This can occur in people with heart or lung disease, or those with blocked blood vessels. A reaction to medication, particularly sedatives or strong medications, can also lead to confusion or disorientation, especially in the elderly. Side effects of these medications can affect the brain, causing confusion or reduced cognitive ability. If you or a loved one experiences these symptoms, do not hesitate. Go to the hospital immediately. Conditions like stroke or infection need to be treated promptly to prevent severe complications and protect long-term health. 5. Severe or sudden abdominal pain. Warning signs requiring immediate intervention. Sharp or sudden abdominal pain can be a sign of serious underlying issues that require immediate medical attention. While many people may think abdominal pain is just a temporary symptom due to poor eating habits or stress, if the pain appears suddenly and intensely, especially in the lower or upper abdomen, you should be extremely cautious. This could be a sign of medical conditions that require urgent intervention, such as appendicitis, perforated ulcers, or internal bleeding. Appendicitis is one of the most common causes of sudden abdominal pain. When the appendix becomes inflamed, the person will feel sharp pain, usually starting around the belly button and moving to the lower right abdomen. The pain may worsen when the person moves or coughs. If not treated promptly, appendicitis can lead to a ruptured appendix and cause widespread infection, a dangerous condition that can be life-threatening. Perforated stomach or intestinal ulcers can also cause intense abdominal pain. especially when the ulcer bursts and create a hole in the stomach or intestinal lining, allowing food and digestive fluids to leak into the abdomen. This not only causes intense pain, but can also lead to peritonitis, a severe abdominal infection that requires immediate treatment. Additionally, sudden abdominal pain could be a sign of internal bleeding, such as stomach, pancreatic, or blood vessel hemorrhage in the abdomen. These issues often result in severe abdominal pain along with symptoms like vomiting blood, black stool, or shortness of breath, and require emergency medical care to stop the bleeding and prevent serious complications. If you experience sharp or sudden abdominal pain, do not hesitate. Go to the hospital immediately for timely examination and treatment. Abdominal issues can escalate quickly and cause life-threatening complications if not treated early. Abdominal pain is not always a simple issue, so prompt medical care is essential to protect your health. 6. Continuous vomiting or vomiting with blood. Signs requiring immediate medical intervention. Vomiting is a natural response of the body to digestive problems or infections. However, if vomiting persists for hours or contains blood, it could be a sign of serious health conditions that need immediate treatment. Recognizing and acting promptly when these symptoms appear can save your life and prevent dangerous complications. One of the causes of prolonged vomiting is food poisoning or gastrointestinal infection. In these cases, the body continuously reacts by vomiting to expel harmful agents. However, if this condition lasts for hours without any sign of improvement, it may indicate a more serious problem, such as blood poisoning, intestinal obstruction, or severe gastritis. A more dangerous symptom is vomiting with blood. If you notice blood in the vomit, whether in small or large amounts, it may be a sign of a serious digestive problem, such as a perforated stomach ulcer, gastrointestinal bleeding, or even liver disease or cirrhosis. The blood may appear red or dark like coffee grounds, depending on the origin of the bleeding. While some cases may not be immediately life-threatening, they still require timely treatment to prevent severe blood loss or other complications. Additionally, prolonged vomiting can lead to severe dehydration, causing an electrolyte imbalance that can affect the function of vital organs like the kidneys, heart, and brain. This condition requires immediate medical intervention to replenish fluids and electrolytes, as well as treat the underlying cause of the issue. If you or a loved one experiences persistent vomiting for hours or vomiting with blood, do not hesitate. Go to the hospital immediately for examination and treatment. These symptoms should not be ignored as they could indicate dangerous illnesses that could threaten life if not handled properly. Timely medical intervention is the key to protecting your health and life. 7. High fever with stiff neck and sensitivity to light. Warning signs requiring immediate medical attention. Fever is the body's natural response when fighting infections, but when accompanied by a high fever, stiff neck, and sensitivity to light, it may be a warning sign of a serious condition. Meningitis. Meningitis is a life-threatening infection affecting the protective membranes of the brain and spinal cord. Recognizing these signs and acting promptly can be a matter of life or death for the patient. Meningitis can be caused by viruses or bacteria, with bacterial meningitis being more severe and requiring immediate treatment. One of the hallmark symptoms of this condition is a sudden high fever, often above 39 degrees Celsius, accompanied by a stiff neck. Stiff neck refers to pain and difficulty in moving the neck, making it hard for the patient to bend forward or backward, indicating inflammation near the spinal cord. In addition, patients with meningitis may feel sensitive to light, a symptom known as photophobia. Bright light exacerbates headache and causes severe discomfort. Combined with symptoms such as severe headache, nausea, vomiting, and sometimes confusion or disorientation, meningitis can progress rapidly and threaten the health and life of the patient. Especially in the elderly and children, meningitis may present with different symptoms and can be easily overlooked, making diagnosis and treatment difficult. If these symptoms appear, not going to hospital immediately can lead to serious complications, such as brain damage, hearing loss, or even death. Meningitis is an emergency medical condition and needs to be treated as soon as symptoms occur. Early diagnosis and treatment can stop the progression of the infection and reduce the risk of severe health consequences. If you or a loved one shows signs of a high fever, stiff neck, and sensitivity to light, do not hesitate. Go to the hospital immediately. Timely intervention can save your life and prevent dangerous complications. This video emphasizes the importance of recognizing warning signs of health problems and acting immediately when they appear. Symptoms like sudden chest pain, unexplained shortness of breath, or sudden confusion could indicate serious health issues, including stroke, heart attack, or brain infections. Ignoring these signs can lead to severe consequences, especially for the elderly, whose immune systems are weaker and recovery is slower. The key message the video conveys is that no unusual signs from the body should be ignored. While you may think it's just a temporary symptom or not serious, these signs could be early warnings of serious health conditions that require immediate medical intervention. Seeking medical help as soon as possible can halt the progression of diseases and prevent irreversible damage. The video encourages everyone to trust their bodies and not hesitate to go to the hospital when experiencing unusual symptoms. Prompt action not only helps protect your health, but also helps protect the future and lives of your loved ones.